So how did you hear about the Golden Hand program?
Well, I heard about it from a friend of mine named Angela, who actually told me about Leslie. And Leslie gave me a call, and Leslie, I think Angela told her that I, of all of my conditions and all the things, and that I would greatly benefit from being a candidate for this.
Okay. And do you currently have many side effects? Because you spoke about side effects, so
I
you
have a
do
lot of
experience
side
side effects.
effects. Yeah, I have side effects. Well, currently, like I said, I go out and do things during the day. I'm not employed at the moment, so I'm being taken care of by the city. Uh, they actually have a program called HASA, which is the HIV Services Administration, that have been helping me. And currently, I probably get around a lot because I have a lot of doctor's appointments with all of these things, as you know, going on. So I'm constantly trying to keep, you know, the big thing is to try to treat them, and so I have to go to different appointments, and so I go around a lot, do a lot of things. I go to fellowship, I meet, at places where we are HIV, and so getting around is very painful for me. I have to sit sometimes, and so side effects from certain medications give me nausea, and and also appetite loss, and so basically I won't be able to. I get sick sometimes, when I'm walking
Mm-hmm.
around, so I have to go into a store or something to get sick in the bathroom.
Mm-hmm.
I mean, the nausea and the aching in the stomach is really severe, and that is a side effect from some of the medications, as well as I think just basically some of the ailments that I have. Side effects for other medications. I have pain medications. I have side effects. I have the pain medication I'm on is Vicodin, and it causes a lot of side effects because if I'm not on it or I don't take it, you become addicted, and I don't really want to go that route, as I said. So I think that it would be helpful with the side effects.
Now, it was so interesting because you mentioned two very important things here. That you said you have side effects, but they're currently treating you with more additional medication for your side effects.
Yes, that's a little bizarre thing for
It's,
me. I feel like, people with HIV are like they keep our HIV at a certain level. Like we're being healed, we're not terminal anymore, and we survive. But the thing is that we're suffering from all these side effects that are actually ruining our organs. So I think what happens is we have other problems on top of that because of the side effects coming from medications, and of course prescribing pain medications that cause, we know what that all causes. I mean, so, yeah.
Now, and how many pharmaceutical drugs do you take daily? Prescription drugs are
As
currently.
far as everything,
Yeah,
I
how many
take
drugs?
one. Okay, I take for the HIV. I'm taking Truvada. No, not Truvada. Descovy. I take, that's one. I take Norvir, Prozista. I take lithium for my mania. I take Klonopin for my anxiety, and I'm taking pain medication for my hand, Vicodin, and I also take a few other things, multivitamins, but I have other ones going on, but they're like, not every day that I have to take them. I'm not really sure at the moment, but those are the main ones.
Okay. So as we sit here and we're listening to you, what is the if there is anything that you would like to uh, have accomplished through participating in this program, what would that be?
Well, as I said, I think that, alternative ways of dealing with this, all these conditions that I have, because I've gone to therapy. I've done therapy for the arms. It didn't work, I mean, even if there's alternative ways of doing therapy, I mean, really, and insurance doesn't pay for that much for, 12 weeks a year, I believe. And so, other alternative ways of handling the hand situation. I mean, I just feel like, all of these things will help me.
Okay. Well, I
Is that,
think
was that, maybe I just got lost in that question, though. I can't remember what you said exactly. What was it?
well, no, I just wanted to pretty much reiterate or re-ask the question of what do you feel would benefit you the most from this program?
Yeah, I feel that would help. I feel like you guys educating me on all of these things would be really great because I really want to know about the alternative ways of doing these things because, of course, I feel like the medications are killing us. But, that's just a personal statement. As much as they help us, I do believe they have their problems, and I think that I'm going to start eating better. Actually, I'm currently taking the hepatitis C medication, which is a 3-month stint. and I will be cured from it. Hopefully, that's what they say. And I have I have many side effects from it, and I mean, it bothers me. It's the insomnia I get, and also the stomach problems, the stomach severely from that. So I just think these medications are great in some ways, but they're not good in other ways. And if I can have something that you guys can help me with, that'll offset all of that stuff, that would be great. And also, if maybe you can help me with anything else that will help making more comfort, with all of these conditions that I have.
Well, when I listen to you, Kenny, I am certain that you will find that the Golden Hands program will educate you and introduce you to various ways to alleviate a lot of your symptoms that you're suffering from and to give you a healthy alternative solution.
Thank you very much for that.
And we thank you for participating in the Golden Hands Pilot Program, and we're looking forward to having a continued relationship in helping you get better.
I am too. Thank you so
Living
much.
a healthy, happy, well life.
Thank you very much.
Well, thank you.